All right, so this is the first scenario. This is just an example that I'm going to talk through, and we'll talk through the answers as well. So essentially, you'll be given something similar to this, and you'll be given 5 minutes to prepare. So I'm not going to take 5 minutes and prepare for with this one, but for the next few that I'll hopefully have a couple of volunteers for, we'll do it in real time. So this example, Felicity is a 56-year-old woman presenting with breathlessness and fatigue over the last 2 months. She's been previously healthy, and these symptoms commenced shortly after her husband suddenly died in a motor vehicle accident. She's not on any regular medications and takes valerian occasionally to help her sleep, and remifenin, which is black cohosh extract, for her menopausal symptoms. And as you can see there, down the bottom, it says 4, 3, 3. So we know that there's 3 questions. The first one is for 4 minutes, second is for 3 minutes, and the third one is for 3 minutes as well. So the examiner will ask you, and these questions are not written down, so if you don't understand the question or you haven't heard it correctly, you want to clarify, you can always ask them to repeat the question. So the question for this case is, list the differential diagnoses for Felicity's presentation and how you will assess for the most likely diagnosis. And you're given 4 minutes to now just tell them all of the answers of what you have. What I would recommend for basically all of your STEMs, do have differentials in your mind, because this is a very common question that they ask. They also commonly ask, what is your management? So again, thinking of the likely questions that they're going to ask you will allow you to prepare quite well for the answers. So for this particular case, this was actually a case presented by Akram, so just taken it from their presentation for this particular one. The other 2 I've made myself. So the differentials that they have said, so they've split them up quite systematically, and you do need to be systematic in when you are presenting your answers. That is one of the marking criteria. So for this particular case, differentials would include heart failure, acute MI, atrial fibrillation, COPD or asthma, an exacerbation of either of those 2, pneumonia, PE, pleural effusion, lung cancer. So essentially just working down through your systems, iron deficiency, anemia, leukemia, infection, thyroid dysfunction, depression or anxiety. Again, something to make sure that you do consider in almost any presentation. It may have an element in there. And any adverse effect of medication, sleep deprivation. And you would need to obviously discuss that. You would do a focused history examination, going through both her medical, surgical history. You can go through her sexual history, just anything that you think is pertinent to the case, and doing a focused exam. They might ask you specific questions about what kind of exam you will do, and you will need to explain how you would go about doing that. And doing investigations based on the differential diagnoses. They might again ask you, what are the specific investigations that you are going to do? With regards to being prompted for questions, it can go either way. Sometimes it's either because you've gone off track and they just want to bring you back, or they just want to delve a little bit further into seeing how much knowledge you have in that area. So don't be put off by them probing you or asking you questions. So question 2 for this particular one. So Felicity has a BP of 110 on 60 millimeters of mercury, regular pulse of 80, JVP at the angle of the jaw, displaced apex beat, bibasal coarse inspiratory crackles, and bilateral pitting ankle edema. What is your diagnosis and next steps in her management? And you have 3 minutes to discuss all of this. So hopefully that quite clearly demonstrates that she has heart failure. And then you would probably discuss your immediate management, your medium term, and then long-term management, if that's the way that you want to think about it. And it would also be quite determined by where you are. Are you in the hospital? Are you in the GP practice at the moment? Are you actually just on call and the nurse has told you about this lady that's got these findings? So as you all know, so positioning, high flow oxygen, nitrates if not hypotensive, non-invasive ventilation can be considered, using furosemide, and making sure that she's got a catheter if that's the case, calling the family, or if she's got a EPUA potentially, and then discussing with retrievals. And if this patient is not going to be able to be managed in your StAMPSville hospital, which is usually the case, you need to be calling retrievals and having a chat to them. Your medium-term management, you can include looking at her medications with a review of that, and even getting the pharmacist involved in doing a medication review. You can consider a GP management plan, and they might ask you what that entails, what are they entitled to. Potentially they could even ask you like the billings associated with doing a GP management plan. It's all fair game, essentially. And getting her involved with support groups, if there's any local heart failure groups, or ones that she can phone up, or anything that's available online. They want you to be able to answer in a way where you're looking after the patient as a whole in that rural context. So the third question for this case, Felicity is feeling down following her review with the cardiologist confirming Takotsubo cardiomyopathy. How will you discuss this with her, and what can you offer to support her management? And you have 3 minutes to discuss this one. So again, you can say overarching statement: she's potentially depressed. I want to assess her mental health. I want to do a risk assessment, see if she's got any thoughts of self-harm or suicide, any homicidal ideation. Has she got access to anything? Thinking again in a rural context, is she a farmer? Does she have access to firearms? You know, high-speed motor vehicle accidents are quite common in rural areas. So just being mindful and open to those kind of things. Managing her grief currently, and talking about the psychological effects of the cardiomyopathy with the patient. You can talk about the management of Takotsubo, doing a GP management plan, a GP mental health plan, support groups as previously mentioned as well. So yeah, you can